Neuwied is a German city found on the outskirts of the city of Bonn, another German city located on the banks of the Rhine. Neuwied is located less than an hour between Frankfurt and Cologne-Bonn international airports. It is in this strategic locality, located just a stone's throw from Bonn, that Walter's Fomuki, doctor specialized in the treatment of prostate cancer, has taken residence to set up his clinic called Urologie Neuwied. Urologie Neuwied, situated at the heart of Neuwied, receives patients every day from Monday to Friday between 8 a.m. and 5 p.m. A warm multi-language reception is reserved for all patients from all over the world. Equipped with state-of-art medical equipment, Dr. Fomuki specializes in the detection of prostate cancer, its treatment, and even the most advanced and desperate cases of prostate cancer.
I will use this model to show you where where the prostate is. This is the bladder. Then you have the rectum here. The bladder is the reservoir where urine comes in before we go to urinate, and then this is the rectum where physics is being stored before it passes out. Just below the bladder is the prostate, right in front of the rectum. This position is very important because very soon we'll see that we need this anus in order to to be capable to palpate the prostate to see if it's okay or not. Unfortunately, there are actually no symptoms when you're having prostate cancer at its early stages. When you start having symptoms like urinary retention, going to the night to the toilet, nicturia, which means getting up in the night more than twice to go and pass out urine, or you start having erectile dysfunction, or you're having lower back pain, and so on. These are symptoms that could be associated with prostate cancer at its little bit late stage. I find this topic very, very important because statistics show that 70% of 70-year-old men have prostate cancer, 80% of 80-year-old men have prostate cancer, and 90% of 90-year-old men do have prostate cancer. Apart from lung cancer, prostate cancer is the cancer that kills men more than any other thing. It even kills now more than colon cancer. So prostate cancer is now at the second position, of killing men.
Bearing in mind that the untracked and poorly controlled prostate in people aged 45 and above, like many other diseases, can be hazardous to one's life, Dr. Fomuki hereby outlines some of the useful tips on how to steer clear of such situations.
If we could do our normal regular checkup and know and discover it at the right moment, we can cure it exactly. Some risk factors that are associated with prostate cancer. Age is number one. Once we're 50 years and above and so on at 60, it's a risk factor that we cannot change. So that's one of the risk factors that's we have to develop prostate cancer. The other one is the race. Just because we're black people, we know that black people tend to develop prostate cancer more than whites, and then even more than people from Asia. So that's the second risk factor. Then we also know that when somebody in the family is positive, we have a history of prostate cancer, the chances are more than double for men from this family. Your father is having prostate cancer, the son, you need to start doing a checkup a little bit faster because the chances that you're going to get prostate cancer is more than double.
In the Urologie Neuwied clinic, cultural, sociological, and traditional differences are taken to account for the scrupulous respect of each patient. Dr. Fomuki, through his Urologie Neuwied clinic, works in close collaboration with renowned hospitals within the town of Neuwied. At Urologie Neuwied, all your illnesses and even the most advanced state of prostate cancer would become under control thanks to Dr. Fomuki and his high-quality staff, as well as his state-of-art equipment, which are at everyone's disposal.